sanitation information and practices that are essential for preventing a wide range of diseases. For example, many people now appreciate the need to wash hands whenever they come from the toilet. They also wash hands before and after eating. In an effort to improve medical access, the project has worked closely with Rugarama and Mutorere hospitals, Muko and Jitovu Health Center 3 facilities to recruit 577 Batwa into micro-insurance scheme.
The health insurance scheme has done great because, the Batwa people are really poor. They are the needy people. We have also found it hard to have all the Batwa community exempted from payments, as our health facility is a non-for-profit. So with the help of the care, they were enrolled into the scheme, and they normally come for the services. The disease trend has really reduced.
The medical insurance scheme is very good. For example, when I went to deliver this baby, I was given special care until I gave birth. My baby was also given the necessary care before they discharged me.
And through the advocacy efforts of the project, the health centers and hospitals have appreciated the need to intensify medical outreaches, especially to the hard-to-reach areas where most of the Batwa have been resettled. Such outreaches have been instrumental in overcoming the long-distance challenge, which has for long hindered community members from seeking medical care services. And so, the health behavior and health status of many Batwa people has significantly improved. The low literacy levels amongst the Batwa has been a very big handicap for their development. So, under this education subcomponent, Care International in Uganda partnered with African International Christian Ministries and the government functional adult learning instructors within the districts to, among other things, sensitize the parents about the need to send their children to school.
Functional adult literacy is not only on writing ABCD or writing the name or doing the arithmetic, but also opening their mind, involving them into debate about their life. How do they like to live? What do they need? How do they look at themselves in comparison with the other people within the vicinity of their community? So we sensitize them to compare. We say, don't you see what is happening to the other people? Don't you see the Bachiga children go to school? You also have to take your children to school. We give example of leadership. You see that a Gombora chief. You see that a counselor. You see the headmasters. You see any position of leadership in society. It's because of education. And so in order to be like others, you have also to take the process that they have taken. And through that way, the Batwa now have been convinced to take their children to school. And they have come out. Now, if you go to them now, they can ask you questions. Why you have come? Why do you want to ask a question about their life? What are you going to use the information for? Their level of literacy is really moving up.
519 adult learners have been equipped with reading, writing, and mathematical skills. This, plus other essential information, has enabled the Batwa to make informed decisions in their day-to-day undertakings.
In the VSRA, we have bookkeeping. So under the FAO, the Batwa have learned how to read and write. And so when they are meeting in groups, they are able to record, they are able to take the proceedings of the VSRA. And then under the health, when they go for immunization or when there are outreaches programs, there are areas when the Batwa need to read a bit, or when they have immunization cards for their children. So the FAL has helped them to write their names and to be able to know the numbers. For example, those who are in insurance have numbers, so they're able to know who they are and they're able to go by that. And then under agriculture, there we have trained them in better agronomic practices. And out of that, we have had 2 producer groups formed and registered with the district commercial officer. With the FAL advantage in the HIL project, the Batwa have been able to gain from the CDD money, where, for example, in the CDD money, they are required to write proposals and write something to show what they need. They have been able to use that skill to get those benefits.
Under the Social Empowerment and Equality subcomponent, CARE International in Uganda partnered with Kisoro District NGO and CBO's Forum to equip the Batwa with knowledge and skills to enable them participate actively in community meetings through which they can contribute to different decision-making processes at the different levels. The project engaged the district community development officers and other relevant agencies to sensitize the Batwa about their rights, roles and responsibilities. The underlying goal was to empower them to be able to demand for their rights from their leaders. Slowly but steadily, the Batwa are starting to exercise their rights.
Abachiga used to sexually assault us and walk away with it. But now we are empowered. We can no longer keep silent when our rights are violated. We know where to report and we can demand for justice because it is our right.
In every sub-county where we have Batwa, we have Batwa sub-county forums demanding for inclusion in the service delivery. We give them the skills to identify their problems and how they can lobby, advocate for their issues, and also to pressurize government to look at their plight.
They are even now fighting for political posts. They wanted to be LC1s. They have even gone to an extent of having educated children who are now agitating government to represent their people, the Batwa community, at parliamentary level.
The project has also empowered the students to form the Great Kigezi Batwa Students Association, through which to advocate for the advancement of the Batwa concerns up to the highest possible level.
This association will help us to unite the Batwa. We speak together to advocate for our rights. We plan together. If possible, we make one organization. We know that this organization supports the Batwa. It is also helping us to continue contacting the government, letting them know that we really want compensation. For example, last year, CARE also helped us to go to Equal Opportunities Commission to take our petition there.
Under this social empowerment subcomponent, 917 people, including Batwa women, have been empowered and they can freely and ably participate in the public forum. All these successes notwithstanding, challenges were also part of the journey.
The HIL project came in to address several issues that were limiting the Batwa to live a normal life like others that were living. But among the challenges, I would say, attitude takes time to change. So the 2 years were not enough at all. Another challenge is other development actors. It has taken them so long to appreciate that the Batwa can also live and work like anybody else. But through our advocacy strategies, we've tried to bring them on board, but I still see they still need that pushing here and there so that they start fully to appreciate. Then we do not build for all the Batwa, simply because the land is expensive. Our budget could not cover all that we would have wanted.
There are also great lessons that can inform future development efforts, especially those targeting the Batwa or other groups of people in a similar state.
For me, the biggest lesson I've learned from the implementation of HIL is that even some of those people we sit and say they are chronically poor, they are not willing to change, they have no initiative. You touch a small switch somewhere and then you see the change that you want to see. It's about trying and implementing appropriate models that work for them. Because people are saying, but why do you go and support a VSLA group when each member is saving 100 shillings per week? If you talk about it in terms of money, indeed it does not make economic sense. But if you talk about it in terms of the full package of the benefits that come with the VSLA, then it makes both social and economic sense. Yes, the Batwa are saving 100 shillings a week, but what does it mean in terms of the social benefits that come with VSLA? They are now registered as formal groups, legally recognized under the law. We have linked them to local governments. Now they are being supported through their groups to access CDD money. They are accessing NADS money. They are accessing insurance support. And for me, that is a very big achievement over and above the 100 shillings they save in their VSLA when they meet.
The HEAL project has come to an end with outstanding success, but the need to support more Batwa is even bigger.
The Batwa project, I think, has been one of the most beautiful pieces in Care Uganda, because we are talking about a group of people whom you're working with from scratch. We said, let's demonstrate that when even the chronically poor people are engaged and shown how to do things, they can come up and try to support themselves. We have achieved all that we have achieved, but for me, I think there's still a lot to do with the Batwa, and there is also a lot to do even with the surrounding communities, so that at the end of the day, really we have a community which is coherent, economically empowered, socially coherent, and then that will catapult them even to another level. But it's a responsibility of Care, our peers, but also government, which is at the end of the day responsible for the overall development of this country.